Yes.
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 We shall begin. All right, guys, today we're going to talk about
Blood pressure.
Yes! How did you know? Okay, Zoom people, what are we going to talk about today?
Blood pressure.
Oh, there's people in the waiting room. Should I let them in or should we just... All right, I'm feeling generous. Although it is going to make for a very strange YouTube video when we all watch it later, but okay. All right. Okay. Now, let me start over again. And this time I'm really not letting people in. All right. Ooh, this is not what I want. I wanted this version. Okay, we're going to try again. Today we're going to talk about
Blood pressure.
Okay. Does anybody, don't look, does anybody know what blood pressure is?
The force that like blood has when it pumps against the walls and like arteries.
That's exactly right. Did anybody not know what blood pressure was? Zoom people, you all knew? I wish I could like somehow see who's on Zoom. I heard something. All right, let me rephrase this. Did any of you guys already know what blood pressure was?
Yes.
Yeah.
Yeah.
Yes.
So all but 4 of you had no clue what blood pressure was. I'm just trying to gauge how rudimentary I need to get in, you know, because if you already know, I'm not going to stand here and explain. All right, so I've drawn this guy several times now, but I'll do it again. What was this thing?
Red blood cell.
Yes! Okay. Now, I had spoken several times about these red blood cells because what do they do that's really important?
Carry oxygen.
They do. They carry oxygen. And where do they get the oxygen and where do they take it?
They take it to like the other organs,
Right.
and they get it from the blood.
Where does the blood get it? It is the
And
blood.
it's the blood.
It is the blood. Where does it come from?
Like, is it when you breathe in?
Yeah,
Just
yeah,
you?
it's air.
Yeah.
It's like air through your lungs. Okay, so it goes to the lungs, picks up the oxygen, and takes it to organs. And then everybody, what happens if the organs do not get oxygen? We had a whole lecture about it, and then you may have noticed on the, yes, hypoxia. On the subsequent tests that didn't even have to do with it, I snuck in a hypoxia question, didn't I? Very important. Okay, so this is very important because these red blood cells are carrying oxygen to our tissues, right? Now, if there's, we'll do like 2. We'll do like one like this, and then we'll do one like this. See how one is big and one is small? This is going to be high pressure on the vessel wall. This is going to be low pressure on the vessel wall. So when we talk about pressure, this is where the pressure is, on the wall of the vessel. This is a blood vessel right here, and this is the contents of the blood vessel, these red blood cells. Is everybody following me? I know everybody in this room is.
Yes.
Everybody on
Yes.
Zoom. Okay.
Yes.
Excellent.
Yes.
All right.
Yes.
All right. So if you think about a garden hose as your blood vessel, if it's just like drip, 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 there's not much pressure. If you turn it all the way and it's like the one that the fire department uses and it's like whoosh and it goes like 1,000 miles an hour, you know, it's high pressure. Also, if you guys remember, like the increase in pressure, like the decreased in diameter increases pressure, which increases velocity from physics, right? Okay, so physics will come back for you in medical school, so don't forget it. All right, so can we all like picture how a blood vessel is a bit analogous to a garden hose. Can somebody check that this is still recording and that I'm on the screen?
Yeah, it's
Yeah.
recording.
And I'm on the screen?
Yeah.
It's not at my like toes or whatever. Okay. Now, I should have like covered this up. What are the two numbers in a blood? I oftentimes ask patients like, "What's your blood pressure?" And they're like 7, and I'm like, "No," because it's got to be two numbers. One number is over top of another number. Does anybody know what the top number is called?
Systolic.
Yes. And somebody who's not Marissa, what's the bottom?
It's systolic, systolic, and then the bottom's diastolic.
Correct. And you can all remember that. Diastolic starts with a D, down starts with a D, diastolic down. You'll never forget it now. It's the bottom number. All right, so we have systolic at the top and diastolic for down. And normal is 120 over 80, okay? That's the lovely number. You kind of want it to be a little bit lower, in my humble opinion. And the measurement, I gotta like, cover some of these up. What does MMHG stand for?
Millimeters of mercury.
You already read it. Okay, hold on. Here we go. There. Okay. Now it won't be so obvious. It'll be more of a mystery when I ask. Okay, so the pressure is exerted on the walls, like I showed you guys before with those arrows, okay? And chronic high blood pressure can damage endothelial cells. Those are the cells of the walls of the vessels, okay? Do you want them to be damaged?
No.
No, you guys are correct about that. All right. Atherosclerosis. How do you like that one? That is a condition that happens whenever you have continuing damage to the endothelial cells, which are the cells that are on the vessel walls, okay? Do you want atherosclerosis?
No.
You don't?
No.
That is correct, everyone. Now, I covered this up. And when you take somebody's blood pressure, what artery?
Brachial.
Oh, did you see it? Okay, you know what? Next time I'm going to get to the slide real quick and cover it up. Yeah, so, wait, people on Zoom, did you guys see it before I got rid of it? What artery?
Brachial artery.
Ta-da! The brachial artery! Okay. And this is crazy, but like half of people have it. How do you like that? Woo! So, I don't know, 2 or 3 of you, I mean, y'all are young, so probably not. Okay. Let me get the big one out so that I can like hurry up and cover it up so that I can quiz you. Oh, well, this is kind of, I won't do it for this one because this is like, you have to memorize this. Okay, so we discussed that what numbers are normal?
120 over 80.
120 over 80. So if you start getting to like the 120s, that's elevated. And then diastolic and less than. Okay, so basically even if it's like normal on the other side, if it gets up to here, you have problems. You can just remember that it gets higher, it's bad. And then if it gets real high, it's real bad. I don't think at this point you need to memorize any particular numbers. Except for, oh my gosh, if it's like 180 over 120, that's a big problem, okay? You're not just going to be like, eat your vegetables. It's like, go to the ER. But there's a slide that will explain the difference. So there's like hypertensive crisis divided between hypertensive urgency and hypertensive emergency. So when I get to that slide, it'll make more sense. But just know that there's different levels. And the more red, the worse you're getting. Okay. Now, I don't need to. Okay. Blood pressure. Pressure on the vessels. We already discussed that the vessels are carrying oxygenated blood through the body. All right. It begins in the heart's ventricles and affects the arteries, arterioles, and capillaries. Here's your arterioles and capillaries right here. How do you like them? All right. Understanding how the heart arteries generate blood pressure will help you understand high blood pressure and how it can adversely affect your health. Now, this is beyond what I want to get into today because I don't want to make everybody have a headache. but there are like feedback and negative feedback loops that have to do with how fast the heart is pumping versus your blood pressure. We talked a little bit about this before, and it's not as straightforward as I'm going to make it seem. But like, let's say your blood pressure drops, and so your organs aren't getting perfused with the oxygen the way they used to be. Your heart might take over or pump faster to compensate for it. Okay, so that's just the little idea about like a feedback mechanism there. All right, so we talked about systolic and diastolic, millimeters of mercury, which is pressure, and then higher than normal force on the walls of the arteries, okay? So we have force, we have it, and the bigger the force on the walls, the bigger the blood pressure, the worse off you're gonna be. And why are you worse off? Because it affects your organs, and then there's some specific organs, okay? So this biggest organs that I think about when it comes to people who have hypertension are going to be the eyes. They get blurry vision. Also, the brain. What is the thing that happens to your brain if you don't get oxygen to it? Anybody on Zoom? You get like the ischemic tissue death in the brain. Everybody knows it. I'm asking because it should be very obvious and easy. Zoom people.
Stroke.
Name the first disease of the brain that comes to your mind.
Stroke.
Okay, the answer is stroke. Yes, everybody. So, is it even on here? Oh, yeah. Look. You could have cheated. Okay, so for people with hypertension, the main organs that I would worry about are the eyes, blurry vision, the brain, you get a stroke, the heart, you get a
Heart attack?
yes, you get a heart attack if you don't get enough oxygen to your heart. And then kidneys, because if you're got all this pressure, your kidneys have to filter that, and they're gonna get damaged if they have to go on overdrive. All right, so eyes, kidneys, heart, brain, okay? And then there are, I mean, yes, erectile dysfunction, but I won't make you guys memorize that for now. But you're gonna have to learn about it eventually. Okay, everybody? Peripheral artery disease. Obviously, like we said before about atherosclerosis, if you keep having damage to the endothelial cells, which line the blood vessels, you're gonna have, obviously, diseases to your arteries, okay? So none of this is good. And then we have, all right, now I talked about blurred vision, hypertensive retinopathy. That's another consequence of high blood pressure. Left ventricular hypertrophy, which your left ventricle, guys, we talked about hypertrophy in a previous lecture. It gets real big, works real hard to compensate for like all the problems, and that leads to heart failure. Heart failure, you have like a bunch of fluid pooling because it's not getting pumped out. And heart failure, good or bad, guys?
Bad.
It is bad. Okay. Correct. I'm glad we're on the same page. Like I said, kidney damage. The glomeruli. Post-streptococcal glomerulonephritis. I just wanted to say that. Does anybody know about the glomeruli? Anybody on Zoom heard of a glomerulus? Anybody ever heard of glomerulonephritis? Oh, for the glomeruli of it all. Okay, well then I won't get into any gloms, okay? But when you guys start learning about a glomerular disease, you're going to remember that Dr. Waggel said it so many times and you had no idea what was going on. Just suffice it to say that this is a region within the kidney. Proteinuria. Can anybody break down the word and try to figure out what proteinuria is? Like, let's say you had no medical experience whatsoever and you just knew words. Do you think you can figure? Yeah.
Yeah. So protein just means protein, and then urea means urination. So probably like urinating a lot more protein or like out of your body.
Yeah. Protein urea. You're urinating protein. Okay? And then chronic kidney disease. And then the other complications that we mentioned. But can anybody name the main organs that I think about when I think about hypertension? Anybody on Zoom?
The eyes, heart, brain, and kidney.
Yes, who said that?
Lavelle.
You're on fire. Lavelle. 100 random points to Gryffindor. Very good. All right. Guys, what did I say? The brain, you get the stroke. The eyes, you get the vision loss. The heart, you get heart failure and heart attack. We'll save this for when everybody's over 18. And then kidney disease. Also, I don't treat very many men, so like erectile dysfunction. Okay, I've actually treated a lot more than you would think. I digress. Those are the main issues. Now, what causes hypertension? Do you just wake up with it one day? I guess in some circumstances, especially when it's secondary, you could, but I haven't even explained what primary and secondary hypertension are yet, so you would not know that. So just forget that I brought up that. But you will, because it's in the PowerPoint. Okay, risk factors. Let me cover up some. All right, I covered up 3. Okay, so genetics means that it's in your what?
Like your blood, your family.
It's in your family, it's in your blood, it's in your DNA. Not much you can do about it unless you get like CRISPR or one of them Gattaca future machines and start altering your DNA, which currently is not legal in the United States. So you're gonna be stuck with that. And then African Americans, they are more predisposed to hypertension. And then, okay, so lifestyle, smoking, alcohol, and poor what? I covered it up.
Diet?
Yeah! If you're just eating junk food and nonsense all day long, you're gonna get hypertension. Okay, inactivity. If you just sit on the couch and never move, like, that's not good. You're gonna get hypertension. So for your diet specifically, if you don't eat enough of potassium, vitamin D, and you eat too much what? Zoom people.
Sodium.
Correct. If you just sit and eat salt. Now, does anybody remember osmosis? Yes. Which I feel like, I guess I was wrong when I said that all high schoolers have to take anatomy. But I feel like all high schoolers have to learn about osmosis. Did anybody on Zoom, have you ever not heard of osmosis? Anybody not hear about osmosis? Everybody knows this concept. Okay. If you have like a whole can of salt and you just eat the whole can, and then you have water, the water's going to stick to you because the water goes to where the salt goes. Does that make sense to everybody? Okay, so if you eat a lot of salt, you retain a lot of fluid. If you have the same space, so this is the diameter of your blood vessel. Okay, this one is slightly bigger. For good measure, hold on. Okay. All right, rough. If you have the same space, but one has a little bit of fluid in it, and one has a lot of fluid in it, which one's gonna have more pressure?
A lot of fluid.
The lot of fluid. So if you sit and eat a whole carton of salt, and then you retain all the fluid, you're gonna have a blood vessel more like this, and your blood pressure is gonna be high. Does everybody understand? Now, I forget what I even covered up. Oh, no, I remember. Okay, comorbidities, meaning like things that occur together a lot. High cholesterol, diabetes, or diabetes, whatever you want to call it. Sleep apnea. Does anybody know what sleep apnea is? Here I'm like,
It's when you need a sleep apnea machine because you wake up in the middle of the night constantly,
Yeah, you stop breathing
Stop
and
breathing.
people snoring. You gotta look at their melon potty score, which no one knows what that is because you haven't gotten through medical school yet. It usually has people that are this
Obese.
obese. Ah, there you go. And then increasing with age. So as you get older, your blood vessels get more stiff, and you get like high blood pressure. So if you like live to be really old, you're probably gonna get high blood pressure. I mean, statistically, right now there's a 50% chance you have it, right? Okay. And then another thing that increases is stress. You ever hear like, hey, relax, stop freaking out, you're increasing my blood pressure, anxiety, that sort of thing. Because increased stress is increased cortisol. So you should probably, well, we'll talk about what to do, but everybody should meditate regardless. Meditation helps with a lot of stuff. Now, remember I said that did I say primary and secondary? Yes, I already said that I was going to tell you about it, but I shouldn't have expected you to know about it because this is like slide 9, okay? So now you should know about it. So people on Zoom, have you ever heard that there are primary and secondary hypertension?
No.
No. Well, now you did. Now you did. So primary is also called essential hypertension, and usually it's like, I don't know why, genetics, lifestyle, whatever. 95% of cases. Secondary is hypertension that is caused by a specific other disease. Okay, and that's when I said earlier, well, I guess you could wake up with it if you all of a sudden got like a tumor overnight or something. Kidney disease, hyperthyroidism, Cushing syndrome, pheochromocytoma, and different medications can actually cause hypertension. Okay, so there's other things besides your genetics and your lifestyle that are causing it, and then that's secondary. All right. I said earlier and explained to you about super high blood pressures and how there's hypertensive crisis and there's hypertensive urgency and emergency and what the differences are there. So the hypertensive emergency is if it's higher than 180/120, excuse me, plus end organ damage. So those would be the things I was talking about before. The stroke, the heart failure, now, okay, Zoom people, what's MI stand for? Especially in terms of the heart.
Myocardial infarction.
Yes. And renal failure. So if your patient's blood pressure is that high and they have any of these things, that's a hypertensive emergency. And what should they do?
Go to the ER.
Yeah, go to the ER. Yeah. Should they sit and have a tea party? No. Should they go do a few laps in the pool? No, they should go to the emergency room. That's right. Hypertensive urgency is the high blood pressure, but they are not showing any signs of any end organ damage, okay? And then I usually play it safe, and if it's that high, I'm like, I suggest you go to the emergency room. So many patients are like, nah, I'm gonna go have my tea party. And I'm like, okay, but might not last that long. Yes, so you need to differentiate between the two, but honestly, to me, I recommend both go to the ER. But that's just me. Alright, so what can we do? Should we smoke a lot? Should we be like chain smoking? Should we be vaping and shotgunning and going to the hookah bar and like... Alright, so we have improves vessel health, and this is even in like quitting smoking for like a short period of time. Like some people are like, oh, I only quit smoking for a little bit. Well, it still had some improvement. Lowering blood pressure from not smoking. And then exercising, obviously. I think most people know that exercising lowers blood pressure. Although I feel like I'm so out of touch with normal people, I don't know what they know. Do normal people know that exercise decreases blood pressure? Okay, all right.
Yes.
Okay, great. I didn't. Maybe they stopped telling the general public. I don't know. So 150 minutes per week lowers your systolic blood pressure, and then you want to have an exercise that you also are gonna want to have a good diet, because you don't want the osmosis. Fruits and vegetables. So Peppa Pig, who is from the United Kingdom, has a song, fruits and vegetables keep us alive. Always remember to eat your 5. But then the United Kingdom changed their guidelines to 7. So they had to change their song to fruits and vegetables keep us alive. Always remember to eat your 7, which doesn't even rhyme. I feel like there could have been another, I don't know, something different could have been come up with there, but what are you going to do? Now, do you guys think that you should drink a lot of alcohol or a little bit to zero alcohol?
A little bit to 0.
Because what was the other thing that I said that alcohol causes?
Hypothermia.
Yeah, alcohol causes hypothermia, but it also causes hypertension. So just don't drink. You guys aren't old enough anyway, right? So you don't need to worry. Now, weight loss, even losing a couple pounds can really help your blood pressure. And like I said before, with the stress, the increased cortisol from increased durations of stressful events. I mean, not like you can really stop external stressful events, but as much as you can also meditate, come to therapy with me, and time management, which none of you here or on Zoom, but a lot of your classmates need to look. Tell your classmates when they work on time management, it'll improve their blood pressure. Okay. All right. Whew, what to do. So this is what to do. If you're the primary care doctor, somebody comes in, they have high blood pressure. Usually, if it's not ridiculously high, you say, let's try some diet lifestyle changes, try to stop smoking, whatever, for a month or 3. And then they come in. If there's no improvement, then you go to medication. You have them monitor their blood pressure at home. I have a lot of my patients monitor their blood pressure at home because some of the medications I prescribe increase blood pressure. And if they're not monitoring it, then we don't know if it's increasing blood pressure or not. You can get home. Well, there's one over there because y'all are going to practice taking each other's blood pressures. You can buy one. I was going to say 2 corporations, but I'm trying to fight monopolies. So buy it from a local family-owned pharmacy for $25. So you could monitor your blood pressure at home, and then we're going to get into the medications. All right, so does anybody want to take a stab at how to pronounce this?
The hydrochloride.
Yeah, it's hydrochlorothiazide. Another one of my favorite words. It is a first line, unless, of course, you have the things I'm about to talk about. First line meaning, if you're prescribing the medication, you would want to try this before some of the other ones. It increases, okay, you guys know what this is, right?
Sodium.
People on Zoom. Ooh, look at this.
Sodium.
Yeah. It increases sodium and water excretion, okay? So what do you think that means from a patient standpoint? In very plain English terms. Instead of, the patient's not going to be like, hey doc, I'm taking this and man, I have a lot of water excretion. What are they going to say to you? Doc, I'm peeing a lot, right? So this is what is called a diuretic. I know the word diuretic sounds like diarrhea, but diuretic means it makes you pee a lot, okay? So if you're going to have to tell the patient, you're going to be peeing a lot, but if you're getting rid of all that volume, there's going to be less pressure on the vessel walls in your endothelial tissue, okay? Which is what we're going for here. Probably not going to love peeing a lot, but they're going to love it more than having a stroke. Probably. depends on your patient. Some of them have different priorities than what you would imagine. So, if you are prescribed, so like I said, this is first line, right? Zoom people, this is for you. Hydrochlorothiazide, first line, and then I said, except for certain circumstances. So if you're giving hydrochlorothiazide and it makes your patient pee a lot, what kind of patient would that not be great for? What organ has to do with peeing?
Kidney.
You guys, I know you know. Zoom people, I'm going to draw it here.
I'm gonna take a quick guess. Sorry. Is it dehydrated people or people with kidney issues?
Yeah, people with kidney issues, that would be cruel and unusual punishment for you to give them something that's going to make them pee a lot, okay? Now, lithium levels. Lithium is a drug that I prescribe a lot. It is for bipolar disorder. It does all sorts of fun stuff. You would not want to give hydrochlorothiazide to somebody that is, well, it wouldn't be your favorite thing to do because it can lead to toxicity, okay? If people have low potassium, you might want to think, because this diuretic, remember what a diuretic was? This diuretic causes the loss of potassium, so if they already have low potassium, you don't want it to go even lower. Somebody on Zoom talk to me about what photosensitivity is. Does it mean that you're like camera shy and like you're not tagging yourself on Facebook in the photos, or what does photosensitivity mean?
People who are like sensitive to light.
Yeah, and they get sunburned. So if you start somebody on hydrochlorothiazide, you want to tell them, don't go out and lay out on the beach. See how it affects you. You could get sunburned much more easily than what you're used to. Am I still being recorded?
Yes.
It didn't die?
That's good.
Okay. Other effects. Dizziness, when we talked about the increased urination. Hyperglycemia. What does that mean?
My blood sugar.
Yeah, high blood sugar. Hypoglycemia is low blood sugar. You can figure out a lot of these words and phrases by just taking the words apart. Okay, the next type of medication that people take for high blood pressure are ACE inhibitors. They usually end in pril, like captopril and enalapril. Woo! Really? Okay, the way these work is they block angiotensin converting enzyme. Okay? I won't get into that. Unless some of you are really intrigued by angiotensin converting enzyme. No. It prevents vasoconstriction. Okay, so remember, we have a blood vessel like this, and then it goes like this. That's vasoconstriction, right? Right? People on Zoom, you agree?
Yes.
Okay, now if we have a blood vessel like this, and it goes like this, what's that called?
Dilation.
Vasodilation.
Dilation.
Correct. Okay, vasodilation. All right, just a little throwback, okay? If we prevent vasoconstriction, what would that do to the pressure on the wall of the vessel?
Increase it.
I know there's double negatives here.
Okay.
How do I say this without using double negatives? I can't. If you prevent okay, what is if it get the blood vessel walls get smaller, what happens to the pressure on the walls?
Increases.
Correct. So if you prevent that,
It decreases.
yes, so if you prevent vasoconstriction, it will decrease your blood pressure. There's going to be so many like negative feedbacks and double, triple, quadruple negative things, so let's get in the habit. I know it's tough. Especially for like endocrine stuff. Woo, the feedback pathways. I'll tell you. Retaining potassium. So remember the other one, you're peeing out your potassium. This one you're keeping it in. So you want to make sure that this person isn't eating 1,000 bananas a day, okay? You want to make sure their potassium isn't too high. Now, this ACE inhibitor has a very interesting side effect of a very annoying continuous dry cough. So some patients, it drives them so nuts that they can't even take this medication. So that's something to keep in mind. You want to take it 1 hour before a meal so that it's absorbed, and you don't want to just randomly stop it cold turkey. Everybody knows what cold turkey means. I don't even know where that came from. What does it even have to do with turkeys being cold? Do you guys on Zoom know what cold turkey means?
Yeah.
And I can just picture it now, me drawing a cold turkey. Okay, anyway. If you take a medication at like medium to high dose and then you just go to 0, that's usually not good, but particularly not good in this medication because you get something called rebound hypertension. And just looking at that phrase, what would you guess the meaning of rebound hypertension is?
When you get high blood pressure again.
Yeah, so you take it, you're fine, you take it, you're fine, you take it, you're fine, you don't take it, and bam, it's like even worse, okay? So you do not want them to just discontinue abruptly because they will get rebound hypertension. I have a lot of patients on blood pressure medications for various reasons because did Zoom and in-person people and even people who are, I guess, watching later on, did you guys see me and Riley, the med students video about off-label medication use? Right answer. How about you guys on Zoom?
Yeah.
Okay, so the off-label medication use, I use a lot of blood pressure medications off-label for psychiatric conditions. One of them would be clonidine for ADHD. And so I have to tell people it's different than Adderall. Adderall's ADHD medication you can take Tuesday, don't take Wednesday, take it Thursday, don't take it on the weekend, whatever. The clonidine, you have to take it every single day for it to work properly. But also, because it is also a blood pressure medication, similar, if you just randomly stop it, meaning you miss it, it can increase your blood pressure. Which is like good or not good?
Not good.
Oh, you guys are so smart. Okay, so no rapid discontinuation. There are some drugs that you can just stop cold turkey and usually nothing horrendous happens to you. This isn't one of them, okay? All right, ARBs. ARB me arties. Come on. Yeah. Dr. Waggel's so funny. She's a pirate. All right, ARBs. The sartans. I need a parrot. So we have like losartan and valsartan. These block angiotensin 2 receptors. Again, I don't even want to get into that. You'll just have to take my word for it, okay? They reduce aldosterone, which leads to a decrease in sodium. So hold on, don't look. Don't look. If you decrease your sodium, you'll also decrease your water retention. Okay, next time I'm gonna put boxes over these and like do an animation where they're revealed. Okay, yes. But you guys already knew that without me like having it up here, right? Okay. Okay, now increasing or causing vasodilation. This is the opposite of, okay, there is actually a difference between, follow me here on this one, it's gonna get trippy. A drug that increases vasodilation and a drug that decreases vasoconstriction. Both of them lead to decreasing blood pressure. One of them does something that leads to less pressure. One of them prevents something that leads to more pressure. There's gonna be so many concepts like that. Your brain's just gonna be tripping, okay? But do you understand a medication can cause vasodilation or prevent vasoconstriction. Now let's get even more trippy out here. What if it causes vasoconstriction? Well, how would that impact your blood pressure? Yes, see now I know that you're following me here. Yes, okay, very good. Side effects of these ARBs. ARBs. As long as I think I'm funny, there's somebody out there on YouTube laughing. I guarantee it. They're like, dang, that doctor is hilarious. It's probably my husband. Hey, babe. Okay, dizziness, hyperkalemia. Does anybody know what hyperkalemia is?
Like calcium.
Too much potassium?
Hypercalcemia is too much calcium.
Yeah.
Hyperkalemia is too much potassium. I apologize that it's not called hyperpotassemia. That would be more obvious, but they like to. Because you know K is potassium on the periodic table of elements. I didn't come up with it, guys. I just memorized it, okay? So we have hyperkalemia, which is an increase in potassium. And rare angioedema. Here's another word that you guys don't need any training, and you can just break it down. I will allow somebody on Zoom to look at this word here and see, without any medical training whatsoever, if you can figure out what it means. And then I'll let you guys just think quietly to yourselves in case nobody on Zoom gets it. All right, so we have two things. We have angio and edema. It was the answer to a previous test question. Remember when I talked about poking somebody's leg, holding it, it left a pit? That was called pitting.
It was edema, swelling, so something with swelling. I'm not exactly sure.
So yeah,
it might be like a
your blood vessels swell up, and it's a allergic reaction type of thing too. It can be deadly. Do you want angioedema?
No.
You guys are so smart. Okay, good. And then this, if you have your patient and they take the other medication, they're like, I can't take this cough. It is just too crazy. This one doesn't have the cough, okay? All right, calcium channel blockers. You guys are sitting here like, gee, I wish that there were more treatments for hypertension. Well, there are. I know it can make your dreams come true, everybody. Okay, so we have calcium channel blockers. We have amlodipine, nifedipine, verapamil, diltiazem. I think I need to say nifedipine again. I don't think I gave it a good try there. I don't know what they do in med school now, but we have to spell these all right, too. It's weird. It's like I'm really bad at spelling, except for extraordinarily complicated, like, medical terms and medications. I can spell all of those just fine. I guess I, like, made room in my brain for the more complicated spelling of things. And, like, for some reason, woman and women, like, I mix those two up all the time. I don't know. But maybe they got rid of having to spell it correctly, because now you probably just would, like, type it in a computer. Now we block. Okay, what element is this? Calcium. Entry into the vascular smooth muscle, which leads to vasodilation. This is how this works. So calcium channel blockers, you'd never believe that they block calcium. Wouldn't that be like wacky though if they just named it this and it didn't do that? I would not be surprised with the way that people name some of these things. Now, here's one for the Zoom. What is bradycardia?
It means a slow heart rate.
That is 100% true. Edema, which we all talked about. Okay. Does anybody know what constipation is? That's a word that most general people know, right?
Yeah.
Okay. Nobody on Zoom knows what it is, though, because I didn't hear any responses. So if you have a patient and they already have problems with constipation, probably not like your best choice for them, right? Unless you don't like them, in which case you shouldn't get into medicine. Go into tech or the IT department. They love to torture people. If your patient is constipated, don't make them more constipated. Rude. Bradycardia. You guys said that it is a slow heart rate, and there is a number, and it's on the screen. What is the number?
60.
Yeah, it's 60. If you're, I wouldn't lose my marbles if I had a very athletic long distance runner, somebody like myself, come in. If it was like 58, I'd be like, okay, we maybe need to look at that again. But usually people who are extraordinarily athletic, in shape, healthy, have lower heart rates. But it is considered bradycardia if it's below 60. Okay, and then we have beta blockers, LOL. But it's beta blocker, OLOL. And that's because they end in OLOL. Like propranolol, which is something that I prescribe off-label for public speaking anxiety. And you'll see why in a second, because I know you're dying to know. Propranolol, atenolol, metoprolol, okay? And then, usually when they have these and they have 10 medications all in the same class, all end in the same thing, and then they just randomly throw one in that doesn't fit, they're going to do that to you. Beta blocker, adrenergic receptor. They decrease heart rate and contractility. Okay, so if your heart is not beating as fast, how will that affect your blood pressure?
Lower.
Yeah, that's right. And our friend vasodilation and reduced cardiac output also leads to lower blood pressure, which is the end goal here when you're treating high blood pressure. Now, you guys are not aware of beta receptors being on the lungs. This is a concept beyond anyone right now. Zoom, people. Okay, so you're just going to have to take my word for it that beta blockers are not good. If your patient has asthma or a COPD, it causes bronchoconstriction, which you could probably figure out what that is from breaking down the word, but I feel like we've had enough of that for the day. Taking a beta blocker can mask symptoms of hypoglycemia. If your patient is diabetic, this might not be a good choice. It's decreasing the sympathetic nervous system, which is why it helps you to look less nervous when you're doing public speeches, which is why I prescribe it for that. But symptoms that people with hypoglycemia would typically have, like increased heart rate, that tell them, oh my gosh, I need to have some kind of glucose, take some sugar, they wouldn't have that symptom, so they wouldn't know if their glucose is too low. And is that good or bad? Zoom, people. Class.
Bad.
Correct. Okay. What is it? Is it the distance is the further people are located? Or y'all on TikTok scrolling on Zoom? I know you guys aren't, because none of you are looking at your phones. See, you're retaining. You guys, your brains are like sponges. Osmosis, right? Your brains are full of sodium and you're taking in and absorbing all the knowledge. No, you don't want the diabetic patient to not know whenever their glucose is too low because the symptoms are being masked by the beta blocker. They'll pass out. They could go into a coma. Do you want your patients to go into a coma?
No.
People on Zoom?
No.
Okay.
No.
Okay. I kind of just making sure you're awake there. Get it? Okay. All right. Well, was that a fun time or what? Everybody that's here, we're going to practice blood pressures. Everybody on Zoom, I don't know, continue scrolling on TikTok. Okay. Any questions? Besides, Dr. Waggel, where did you learn that amazing pirate routine that you did? It takes years of training, okay? But any other questions besides that? Anybody on Zoom? Okay, somebody ask one question, please. Humor me. Somebody on Zoom.
Do you recommend using like the automatic pressure systems to calculate blood pressure, or like the older ones that like might still work?
That is a great question. Who said that?
Lavelle.
Well, this is the second time I've heard from you, and the second time I've heard your name in this session. I like the participation. What Harry Potter house are you in?
I think I'm a Gryffindor.
Okay, 100 points to Gryffindor. Thank you. The answer is in my clinic for my purposes, because I also obtain physical exams with, usually, if you've seen my video about some of the weird stuff I get from the primary care doctors, usually and hopefully it has vital signs in them. I just use the automatic cuff that you all see before you here. I'm perfectly capable of doing the stethoscope one. It's just way easier to use the automatic one. If my practice was like a cardiologist clinic and like we needed to be real serious and we're taking it on both arms and having it taken at different times and people sitting down and standing, like I would probably do it the old-fashioned way with the stethoscope. So that is the answer to your question, and I very much appreciate it. And you may see some bonus points randomly added to one of your assignments because you were the only one from Zoom who asked a question.
Thank you.
All right. We will depart. It's been fun. Hopefully I didn't raise anybody's blood pressure today. Okay, bye everybody.
Bye. Thank you.
I think.
Bye. Thank you.
Ooh, this is trippy. Look at this. Whoa. What is going on? We've reached the singularity, guys. Oh. I guess these two people are late. Oh, wow. Okay, so Marissa, you know how to take blood pressure.
Yeah.
Like